Hello and welcome to video lesson number 3. We are glad you have joined us. In our previous 2 lessons, we have explained what telemedicine is, types of telemedicine platforms, how telemedicine works and how healthcare providers and insurers can use it to reduce cost, improve access to healthcare and deliver satisfactory health services to patients. Today, we will be discussing the benefits that telemedicine provides to patients, healthcare providers, and health insurance companies. While telemedicine was initially introduced to improve access to care for patients in remote areas, it has since expanded to offer a wide range of benefits to patients, healthcare providers, and health insurance companies. In this lesson, we will explore these benefits in detail, and how they have transformed the healthcare landscape in recent years. So, let's dive in. What are the benefits of telemedicine? To find out the benefits of this type of cover, we will look at how it benefits everyone on the cycle from patients to healthcare providers and healthcare or medical insurance providers. There are a lot of benefits of telemedicine if one was to analyze the entire chain. Here are a few we have compiled. 1. Benefits of telemedicine to patients. A. Convenience. Telemedicine provides patients with the convenience of receiving medical care from the comfort of their own homes. Instead of having to travel to a healthcare facility and wait for appointments, patients can now access medical care from their smartphones, tablets, or computers. This eliminates the need for patients to take time off work or plan for childcare or transportation. Patients can also schedule appointments at a time that is convenient for them, which can reduce the amount of time they have to spend waiting for care. Additionally, telemedicine can offer flexibility for patients with mobility or transportation issues, making healthcare more accessible for those who may have difficulty accessing traditional healthcare services. Overall, the convenience of telemedicine can greatly improve the patient experience and increase patient satisfaction with their healthcare. B. Improved access to care. Patients who live in rural or remote areas may have limited access to healthcare providers. Telemedicine can bridge this gap and provide them with access to specialists who are located in other regions. It can greatly benefit patients by improving their access to healthcare services, especially for those who live in rural or remote areas. With telemedicine, patients can easily connect with healthcare providers regardless of their geographic location. This allows patients to access specialized care, such as consultations with medical specialists, that may not be readily available in their area. Patients can also receive medical attention in a timely manner, as telemedicine eliminates the need for long travel times and wait times associated with in-person appointments. Telemedicine can also help patients avoid unnecessary emergency room visits by providing them with the ability to connect with a healthcare provider to discuss their symptoms and receive guidance on whether or not they need to seek further medical attention. Overall, improved access to care is one of the most significant benefits of telemedicine, especially for patients who may have previously faced barriers to accessing quality healthcare services. C. Faster care. Telemedicine can speed up the process of receiving medical care. Patients can often get appointments with healthcare providers more quickly than they would with in-person appointments, which can be especially important in emergencies. It can benefit patients by providing faster access to medical care. With telemedicine, patients can often receive medical attention more quickly than with traditional in-person appointments. This is because telemedicine eliminates the need for travel time and waiting room times, which can be especially important in emergencies or situations where a patient needs urgent medical attention. Telemedicine can also provide patients with faster access to medical specialists, as patients can receive consultations and diagnoses remotely. For example, if a patient needs to see a dermatologist for a skin condition, they can schedule a virtual appointment with a dermatologist and receive a diagnosis and treatment plan without having to wait weeks or even months for an in-person appointment. Overall, telemedicine can provide patients with faster access to medical care, which can greatly improve their chances of a positive health outcome. D. Cost savings. Telemedicine can be more cost-effective than in-person visits, as it eliminates travel costs and can reduce the need for medical facilities. It can also benefit patients by providing cost savings. By eliminating the need for patients to travel to healthcare facilities, telemedicine can reduce transportation costs, such as gas and parking fees. Patients may also be able to avoid taking time off work, which can result in lost wages. Additionally, telemedicine can help patients avoid unnecessary medical costs, such as emergency room visits, which can be more expensive than telemedicine consultations. In some cases, telemedicine consultations may be less expensive than in-person visits, which can also help patients save money on healthcare expenses. For example, a telemedicine consultation for a minor illness, such as a cold or flu, may be less expensive than an in-person visit to a primary care physician. Overall, the cost savings associated with telemedicine can make healthcare more affordable and accessible for patients, especially those who may be underinsured or have high out-of-pocket expenses. In the second subtopic, we examine benefits for healthcare providers. These are doctors, nurses, anesthetists, specialists, and anyone involved in diagnosing, examining, and treatment. Basically, the people we go to the hospital to see. This subtopic also examines the benefits telemedicine provides the institution of the hospital itself. These are the benefits to healthcare providers. A. Increased efficiency. Telemedicine can increase the efficiency of healthcare providers, as they can see more patients in a shorter period of time and eliminate the need for time-consuming administrative tasks. Telemedicine can benefit healthcare providers by increasing efficiency in delivering healthcare services. With telemedicine, healthcare providers can see more patients in less time, as virtual consultations can be conducted more efficiently than in-person appointments. This can allow healthcare providers to increase their patient load and serve more patients in a given time period. Telemedicine can also reduce the amount of time providers spend on administrative tasks, such as managing paperwork and scheduling, as many telemedicine platforms integrate these tasks into the virtual visit process. Additionally, telemedicine can improve the accuracy and completeness of patient data by allowing providers to access electronic health records and other important patient information in real time. This can help providers make more informed decisions about patient care and improve overall care quality. Overall, increased efficiency is a major benefit of telemedicine for healthcare providers, allowing them to provide high-quality care to more patients in less time. B. Improved patient outcomes. Telemedicine can improve patient outcomes by allowing healthcare providers to monitor patients more closely and intervene earlier when necessary. It can also benefit healthcare providers by improving patient outcomes. By providing patients with faster access to care, telemedicine can help prevent or manage health conditions before they worsen, resulting in better health outcomes for patients. Telemedicine can also help patients follow up with their healthcare providers more regularly, which can be especially important for patients with chronic conditions who need ongoing monitoring and management. In addition, telemedicine can help patients receive more coordinated care, as providers can easily share patient data and communicate with other members of the care team. This can help ensure that patients receive comprehensive, high-quality care across different healthcare settings. Overall, telemedicine can improve patient outcomes by increasing access to care, promoting regular monitoring and follow-up, and supporting coordinated care among healthcare providers. C. Reduced risk of exposure. Telemedicine can reduce the risk of exposure to infectious diseases, as patients can receive care from the safety of their own homes. Telemedicine can benefit healthcare providers by reducing their exposure to risks, particularly in situations where they may be at risk of exposure to infectious diseases. With telemedicine, healthcare providers can consult with patients remotely, without the need for physical contact, which can reduce the risk of exposure to infectious diseases. This is particularly important in situations where patients may have contagious illnesses, such as influenza or COVID-19. Telemedicine can also help reduce the risk of exposure to workplace hazards, such as chemical or radiation exposure, by allowing healthcare providers to conduct consultations remotely instead of being physically present in potentially hazardous environments. Additionally, telemedicine can help reduce the risk of workplace violence, as providers can conduct consultations from a safe location rather than being present in a potentially dangerous situation. Overall, telemedicine can help healthcare providers reduce their exposure to risks associated with the delivery of healthcare services, helping to promote their safety and well-being. D. Increased revenue. Telemedicine can increase revenue for healthcare providers by allowing them to see more patients and bill for services that might not be reimbursed in traditional settings. Telemedicine can benefit healthcare providers by increasing their revenue. With telemedicine, healthcare providers can see more patients in less time, which can increase their patient volume and revenue. Additionally, telemedicine can reduce overhead costs associated with traditional in-person appointments, such as rent and staffing costs, which can improve profit margins. Telemedicine can also allow healthcare providers to expand their services to new geographic areas or patient populations, which can increase their revenue streams. For example, a specialist in a particular medical field may be able to offer virtual consultations to patients in other regions or even in other countries, expanding their reach and potential revenue. Moreover, telemedicine can help reduce patient no-shows, which can be costly for healthcare providers. By providing patients with greater convenience and flexibility in scheduling appointments, telemedicine can help ensure that patients show up for their appointments, reducing the likelihood of missed revenue opportunities. Overall, telemedicine can help healthcare providers increase their revenue by increasing patient volume, reducing overhead costs, expanding service offerings, and reducing no-shows. The last subtopic lists benefits for health insurance companies. The last group we will discuss under this topic are health insurance underwriters or insurance companies offering health or medical insurance. Some of the benefits for these group include: A. Cost savings. Telemedicine can be more cost-effective than in-person visits, which can reduce overall healthcare costs for insurers. Improved patient outcomes. Telemedicine can improve patient outcomes and reduce the need for more costly treatments down the road, which can also help reduce overall healthcare costs. Telemedicine can benefit health insurance companies by saving on costs. By providing virtual consultations, telemedicine can reduce the need for patients to visit healthcare facilities, which can reduce overall healthcare costs. For example, telemedicine can help reduce costs associated with emergency room visits, which can be more expensive than telemedicine consultations. Telemedicine can also help reduce the costs of unnecessary diagnostic tests, as providers can more easily communicate with patients and provide appropriate guidance on the need for further testing. Additionally, telemedicine can help reduce the need for hospital readmissions by providing patients with ongoing monitoring and support, which can reduce the likelihood of complications and improve patient outcomes. By reducing healthcare costs, telemedicine can help health insurance companies save money on claims payouts and overall healthcare expenses. This can help insurers offer more affordable healthcare coverage to their members and increase their competitiveness in the healthcare market. Overall, telemedicine can help health insurance companies save on costs by reducing the need for in-person care, improving patient outcomes, and reducing healthcare utilization. B. Increased efficiency. Telemedicine can increase efficiency for insurers by reducing the need for administrative tasks associated with traditional healthcare settings. Telemedicine can benefit health insurance companies by increasing efficiency. With telemedicine, health insurance companies can reduce administrative costs associated with processing claims for in-person visits, such as paperwork and billing. Telemedicine platforms can streamline the claims process by automating documentation and billing processes, reducing the need for manual data entry and reducing the likelihood of errors. Telemedicine can also help health insurance companies monitor and track patient outcomes more efficiently, as providers can easily share patient data and communicate with other members of the care team. This can help insurers identify opportunities for improving care quality and reducing costs. Additionally, telemedicine can help health insurance companies expand their service offerings to new geographic areas or patient populations, which can increase revenue streams and improve competitiveness in the healthcare market. Overall, telemedicine can help health insurance companies increase efficiency by reducing administrative costs, improving data tracking and analysis, and expanding service offerings. C. Improved customer satisfaction. Telemedicine can improve customer satisfaction for insurers by providing patients with a more convenient and accessible healthcare experience. Telemedicine can benefit health insurance companies by improving customer satisfaction. With telemedicine, patients can access care more easily and conveniently, which can lead to greater satisfaction with their health insurance plans. Telemedicine can also reduce the time and effort required for patients to receive care, which can lead to greater satisfaction with their overall healthcare experience. Patients may appreciate the flexibility and convenience of virtual consultations, as they can receive care from the comfort of their own homes or workplaces, without needing to take time off or travel long distances. Additionally, telemedicine can help health insurance companies provide more personalized care to their members, as providers can communicate more easily and frequently with patients and track patient data and outcomes more effectively. This can lead to greater patient engagement and satisfaction with their healthcare providers and health insurance plans. Finally, telemedicine can help health insurance companies address access issues for patients in remote or underserved areas, which can help improve patient satisfaction and reduce disparities in healthcare access. Overall, telemedicine can help health insurance companies improve customer satisfaction by providing greater convenience, personalized care, and addressing access issues for patients. The end. In our next lesson, we look at the challenges of implementing telemedicine and how to overcome those challenges. Be sure to join us for that.